Dr. Wolski, you do so much injuries one way or the way, whichever way they come, or just over time, having bones and muscles becoming weaker, becoming disintegrated or whatever. What's your point on surgery, and does your treatment sometimes or often avoid surgery?
That's a really good question. Our philosophy is try therapy first, because we've never had anybody have a staph infection in our therapy area. We've never had anybody die in our therapy area. We've never had just anybody go into a coma from physical therapy, and I've seen all that with surgeries. And for example, I had one lady who had shoulder surgery, and I used to think arthroscopic shoulder surgery wasn't a big deal. This lady, just from the anesthesia, she went into coma for 30 days, and they had to put a tube in her trachea, and they had to breathe for her for 30 days, and her surgeon told her family that she's probably not going to make it, and if she makes it, they're going to pull the ventilator off of her, so she'd have to either breathe on her own or she'd be a vegetable. Fortunately, she came back with minimal brain damage, and so that was one case where she jumped right into surgery before I even saw her. She was treating. She just basically came in with a hole in her trachea, and I said, well, where did that come from? And I got that story. But what we try to do is try to do conservative therapy. I've had another patient where he had jumped into knee surgery right away, and he basically walked in. He was able to walk in with crutches to the surgery, but he got and the surgeon, it was a perfect surgery, but he got a staph infection. It was not any fault of the surgeon, it's just a high risk, and if you have surgery in hospitals these days. But he had a staph infection that was resistant to every antibiotic, and it got into the bone, and they can't fix that. They can't put a knee replacement in because the infection's in the bone, and he's basically walking on 2 crutches for the rest of his life, and he came asking for some pain pills. And that's about all he can do is take medications to stay comfortable and walk on the crutches. And he doesn't want to get his leg amputated. And I've had patients who have had staph infections after spinal surgery. I had a patient, he had a big hole in his neck this big that was oozing pus, and they did skin grafts and did a muscle transplant to try to close that up, and it was just a big mess, and it took a long time. So I've also had two patients die from spinal surgery, and these patients saw top surgeons. The surgery was a top success for both of them, and they died from blood clots from their legs. So. When I tell patients, when you sign that piece of paper before you have surgery, sometimes that stuff happens. So for physical therapy and our pain management program and our work hardening programs, they're a lot safer than surgery, and it's worth giving them a shot to see if they can help you before going to surgery.
Right, because very obviously, if for some reason it doesn't work, in your practice, how long on an average would it take to see that it doesn't work, and now, well, you might as well try surgery? What do you, half a year, 3 months, longer?
Well, for spinal surgery, I tell patients, if you've got unbearable pain after 6 months, it's worth talking to a surgeon. But a lot of times we can get patients fixed up. I personally had a large herniated disc, and I had was called a drop foot. And that's where the nerve was paralyzed, and I was dragging my leg for about 6 months. And usually that's a surgical emergency. But I got better with therapy, and I'm almost 100% right now without ever having to have back surgery for my herniated disc.
Wonderful. All right, so, you can always try surgery afterwards if that one, after a fair amount of time, doesn't work. Because very obviously, anytime you cut the body, even dentists will tell you that cutting a tooth, to put a crown on it, if not necessarily, don't do it, because you just simply don't know what happens to that body part, or in that case, to the whole body once you cut it in. Bodies are not made to be cut. The way I sometimes look at it is like when we were kids and younger, and I grew up more or less in the woods, and one thing we learned from Daddy right away: don't carve things into that tree because you're hurting it. And some trees may easily survive it, but that very same tree which survived it, the next tree, same size, same everything, might not survive it. For whatever damn reason, and so we learned not to do that. And I think that's the same thing with surgery. Bodies react in a funny way. Yes, absolutely, at no fault of the surgeon. Quite often, the fact is, bodies don't like to be cut up.
Oh, exactly. For example, with back surgeries or neck surgeries, patients can get scar tissue forming after the surgery around the nerves, and they've got more pain after the surgery because of the scar tissue than when they started, before the surgery.
Right. Well, I think we made the point. I think you made the point, Dr. Wolski. Go and do the treatment, with steroids, with physical therapy, with other type of medicines, before you go under that knife. It's just, you owe it to your body, you owe it to yourself. Thank you very much, Dr. Wolski.